Welcome to the news at this hour on NT International. I'm Elizabeth Omori. Now let's take a look at the headlines. Presidential Task Force on COVID-19 reiterates President Buhari's commitment to containing coronavirus in Nigeria. The role of nurses and midwives in focus as Nigeria joins global community in marking World Health Day. Plus, humanitarian ministry in Nigeria commences distribution of food items to the vulnerable. Thanks for joining us. China has hit a milestone record as it reports no new death for the first time since coronavirus pandemic officially began. Here is Joyce Ometu with an overview of COVID-19 around the globe.
The World Health Organization says it has no blanket recommendation for countries to slow the spread of the pandemic, but urges them not to lift restrictions too early. Data compiled by Johns Hopkins University on April 7, 6 p.m. local time indicates the number of people diagnosed with the virus globally is now 1,374,605. 77,316 people have died, while 294,319 have recovered. In other news, UK Prime Minister Boris Johnson spent the night in intensive care at a central London hospital after his coronavirus symptoms worsened. Foreign Secretary Dominic Raab has been asked to deputise for the Prime Minister. World leaders have sent messages to Mr. Johnson wishing him well. Meanwhile, UK Cabinet Office Minister Michael Gove is self-isolating after his family member showed symptoms of coronavirus. Let's go to Spain, where there is a slight increase in the daily death toll of coronavirus for the first time in 5 days, as 743 people died overnight, while confirmed cases are 140,510. Reports from Russia say the number of coronavirus cases there rose by more than 1,000 for the first time to reach 7,497 cases in total, while deaths rose by 11, bringing the total death toll to 58. The capital, Moscow, is currently the epicenter of the country's outbreak. Meanwhile, China's National Health Commission has reported no new coronavirus deaths for the first time since the outbreak. The milestone comes as the country prepares to lift all travel restrictions on Wuhan, the city where the virus first emerged. The government is under scrutiny as to whether it is underreporting its figures. The government says more than 3,331 people have died and 81,740 have been confirmed infected. And news from Japan say the Prime Minister has declared a state of emergency in Tokyo, Osaka, and 5 other regions in the country. The state of emergency will kick in on Wednesday and it will last about a month. In the meantime, the Indian government says it will allow some exports of anti-malaria drug hydroxychloroquine after President Trump urged Delhi to release supplies of the drug, seen as a possible treatment for COVID-19. In Africa, out of the 54 countries on the continent, 52 have officially recorded cases of coronavirus. There are only 2 left with no recorded case. The countries without cases are Comoros and Lesotho. As at April 7, 6 p.m. local time, the Africa Center for Disease Control reported a total number of 10,075 confirmed cases on the continent, 487 deaths and 913 recoveries. Still in Africa, Ghana has confirmed 73 new cases of coronavirus, bringing the total there to 287. The new cases were announced early Tuesday morning, and Ghana's health service said the increase in cases was as a result of enhanced contact tracing and testing. And that's it from here. We'll bring you more updates as they unfold. I am Joyce Ometu.
Thank you, Joyce, for the global updates. In the meantime, as at 9:30 p.m. on the 6th of April, the Niger Center for Disease Control confirmed 6 new cases of COVID-19 in Nigeria, bringing the total number of confirmed cases to 238. Out of the 6 new cases, 2 are in Kwara, 2 in Edo, 1 in Rivers and 1 in the FCT. 35 of the 238 cases in Nigeria have been discharged, while 5 deaths have been recorded. Meanwhile, the NCDC already reported that the Lagos State Biosafety Level 3 laboratory has been activated for COVID-19 testing. This brings the number of testing labs in Nigeria to 9. The head of the World Health Organization has condemned as racist the comments by 2 French doctors who suggested a vaccine for the coronavirus could be tested in Africa. Reports say the doctors' remarks during a TV debate sparked outrage, and they were accused of treating Africans like human guinea pigs. One of them, however, later issued an apology. The WHO head said it was a disgrace for scientists to make such remarks during the 21st century, assuring that this will not happen. President Muhammadu Buhari, on behalf of the government and people of Nigeria, wishes Prime Minister Boris Johnson a quick recovery and restoration to full health. In a statement by the Senior Special Assistant to the President on Media and Publicity, Garba Shehu, President Buhari said his sympathy and solidarity are with the British leader as he battles COVID-19 personally, and with the British people as the country battles the devastating effects of the pandemic. President Buhari praised that Prime Minister Boris Johnson will soon be well to resume his great leadership of his country at this most trying time in global history. Secretary to the Government of the Federation and Chairman, Presidential Task Force on COVID-19, Boss Mustafa, has assured all Nigerians of the unwavering commitment of President Muhammadu Buhari to the war against COVID-19 and his readiness to mobilize resources to achieve national objectives. Boss Mustafa, who said this at the PTF briefing in Lagos, described the COVID-19 pandemic as the most significant public health emergency of international concern, having recorded over 1 million cases, causing over 50,000 deaths worldwide, as well as significant disruption of healthcare system, particularly in low and middle income countries. The SGF said in Nigeria's case, the economy is also adversely affected, and was pleased to be in Lagos along with members of the Presidential Task Force on COVID-19 to interact with the Governor of Lagos State and his team, as well as inspect facilities put in place by the government for the control of COVID-19 pandemic.
We must obey rules and regulations. We must stay at home.
Lagos State Governor Babajide Sanwo-Olu appreciated the collaborative efforts and assistance of the federal government towards eradicating coronavirus pandemic in Nigeria. Now to the lockdown on the nation's capital, Abuja. The Center of Excellence has entered its 2nd week. Joshua Ojito monitored the level of compliance in the city center.
It's day 8 of the lockdown in Abuja. The roads are empty, devoid of the usual traffic on a weekday like this, as residents remain indoors in compliance with the presidential directive to contain the spread of coronavirus. Security agents are at strategic junctions to ensure total compliance. The ever-busy Wuse market is under lock and key, as some of the traders who made efforts to access the market were turned back by security personnel. Except for those on essential duties who are seen on the road, there is high level of compliance to the lockdown. In Abuja, Joshua Ojito, NTA News.
And in other news, the World Health Organization observes World Health Day on the 7th of April every year. The contributions of doctors, nurses and other health workers is acknowledged on this day. Now, at a time when the whole world is facing a health crisis following the coronavirus pandemic, healthcare professionals are the frontline soldiers in this war, and the World Health Day 2020 carries more importance than ever. The WHO began observing the World Health Day in 1950. The need for a World Health Day was discussed in the first Health Assembly in 1948. Now, every World Health Day focuses on a certain area in the healthcare system and aims to develop it. Through this initiative, significant growth has been brought to the fields of mental health, maternal and child care, and climate change. The theme for this year is Support Nurses and Midwives. This is to generate attention towards the contributions during the COVID-19 outbreak. The day highlights the current status of nursing around the world. WHO also pledges to make a series of recommendations to strengthen the nursing and midwifery workforce. The year 2020 has also been designated by the World Health Assembly as the International Year of the Nurse and the Midwife. And as Nigeria joins the rest of the world to mark this year's World Health Day, the focus is on the vital role played by nurses and midwives in providing health care around the world. Experts advocate more access to health care without the prospect of financial hardship for the people. Correspondent Alika Okpanachi Aruwa in this special report on the World Health Day takes a look at the healthcare delivery in Nigeria.
It is believed that health is wealth, and the responsibility of the government is to provide healthcare facility for its citizens. With this year World Health Day coming in the midst of the coronavirus pandemic, medical experts say there's need for the Nigerian government to put measures in place to tackle maternal and child health, communicable and non-communicable diseases, emergency preparedness and response, patient safety and the delivery of integrated people-centered care, among others. General Secretary, National Association of Nigerian Nurses and Midwives, Thomas Shetima, maintained that a healthy nation is a wealthy nation.
2020 is the year for nurses and midwives, being that nursing profession is the oldest health profession in the world. It started from 1820 by Florence Nightingale. And if you count from 1820 to 2020, that is exactly 200 years. And that is why the World Health Organization declared this year for the nurses and midwives.
He therefore appealed to the government at all levels to improve the primary healthcare system so that those in the rural communities can have easy access to medical care.
The idea is that if a country like Nigeria is able to provide health care delivery to every Nigerian and everywhere, every part of the country, that means from the villages to the local governments to the state and then federal capital here, we are going to have a very healthy society.
Other stakeholders say more hospitals should be built across the country with state-of-the-art facilities to cater for the nation's growing population. In Abuja, Alika Okpanachi, Aruwa, NTA News.
To talk more on the theme for this year's World Health Day and how health professionals can be encouraged in the face of the coronavirus pandemic in the world, I have with me live in the studio Dr. Obinna Oleribe, a public health consultant. Dr. Obinna, welcome to our studio.
Thank you, Lizzie.
All right, I would like to find out from you, how do you feel that this year's celebration is coming amidst the coronavirus pandemic?
I'm not actually sure whether we are celebrating this year.
Okay.
With over 1.3 million people infected with COVID and close to 80,000 deaths, the world is reflecting. But we are glad that this year we are looking at nurses and midwives who are the foundation and the bedrock of the health system. They are very relevant in all to the continuum of care, from promotion to prevention to treatment and rehabilitation. And this year is a remarkable year because for the first time we are spending a whole year just celebrating those who have given their life, their time, their energy, and their expertise to keep the world healthy and make the world a better place.
Okay, so what's your rating of global nursing and midwifery practice?
It's difficult actually to rate this globally because you don't compare apples and oranges. I rating them based on qualifications, based on the number of nurses that we have, based on dedication to service or what. But globally, one could say that nurses have been very steadfast in providing healthcare services across the world. In some nations, we have enough. In our own country, we don't have enough. A recent survey that was carried out actually showed that we have about 1.06 nurses per 1,000 population. This is far, far below what's expected, but nurses have been very tenacious in helping keep people healthy, helping mothers deliver, helping children stay healthy, helping adults overcome illnesses, and their commitment to healthcare services have been so good that today the whole world is celebrating them.
Okay. Now, so how can nursing and midwifery be strengthened to serve Nigeria and Nigerians better?
That's an excellent question. Okay. I think that we should do what is right, and that is one, we should pay them well. Many of our very highly qualified nurses leave Nigeria to greener pastures when we don't even have enough in this country. If nurses are well paid, the majority will stay back. Number two, we need to empower them with education and in-service training. This should be a continuous phenomenon, not optional, but compulsory for all nurses. We should provide them with enough tools and equipment to deliver their task. We should give them a good working environment. And very importantly, we should recognize them and celebrate them at any given time for the good work they have been doing. If we do this, we will reduce the number of migration of nurses from Nigeria to other countries, until we motivate them to do more for our nation.
All right, Dr. Obinna, quickly, as the world grapples with COVID-19, what is your advice to the people out there and governments on how to contain the virus?
For the governments, Nigerian government have been doing well to a very large extent in terms of controlling the outbreak. Like you heard in tonight's news, we still have less than 240 cases in Nigeria with just 5 deaths. We can contain this outbreak if we do what is right. And NCDC, Federal Ministry of Health, and all stakeholders are doing great. But if they can ramp up what they are doing and scale out and scale up to all the states, that will help us to contain and control the outbreak as quickly as possible. But more importantly, we should protect our health workers. They are very veritable, very important at this point in time. We can't afford to lose any of them. So healthcare service centers should be provided with adequate personal protective equipment that will protect our health workers. Also, they should be trained on how to use them.
Dr. Obinna, this is the much I can take from you. Thank you so much for your time. Thank you for sharing your thoughts with us. Thank you so much.
God bless you.
You're still watching the news on ANC International, reaching you live from Abuja. Let's take a break. More reports ahead when we return. Stay with us.
Now believe this Koroti. You know, fit touch black man. If you like, gather the whole Niger, come together, make a cough. Nothing.
Which one you want?
Give me V&D.
I better get small pieces.
How much you want to give her?
Give me 200. Take your change now. You know what your change is?
My people, this coronavirus, na serious matter. May una wash una hands regularly. Come use alcohol-based hand sanitizer. If you no see water, wash your hand. Make una sit down for house. You see this virus, so it no get leg. Now we dey waka kurukere. No waka around make the virus for die. No forget, say, the betterment of our people. Now for your handy day.
This message is from the Akinfade Foundation in partnership with the National Orientation Agency.
Glad to know you're still there. On the 31st of March, President Muhammad Buhari, following the advice of the Presidential Task Force on COVID-19, declared a lockdown in some hotspot states in the Federal Capital Territory. With this development, only workers whose services are essential were allowed to move around as they work to contain the spread of the virus. Adebola Brooksland Sunday was on the entourage of the National Film and Video Censors Board as they donate essential items to workers who are on the front line of ensuring enforcement.
It is 1 week since the federal government announced the lockdown of the Federal Capital Territory, Lagos and Ogun states. And security agents have been one of the tools used in ensuring the full compliance to this order.
In the Federal Capital Territory, these essential workers mount checkpoints at junctions and even on the expressway in a bid to assist governments in its quest to curtail the spread of the super contagious virus. As a morale booster, the National Film and Video Censors Board, led by the Executive Director, Adedayo Thomas decided to supply them with some essential items at their duty posts.
This stay at home is being complied with because the police are there and they are equally still patrolling. You go to police station, you hardly find everybody. Everybody is on deck. But people are doing charity at various levels. Even within the street where we live, we're doing it. But then you look at those who are in the sun from morning till night and are still asked to continue.
The board is not the only one in this line of thought, as it is being supported by the National Directorate of Employment, NDE.
Decided to put our salaries so that we can assist those that we believe are always in the active line of duty, and that's the security agencies. Our target is 500. We are working for the government. We are also supporting the government in our own way.
The board was at the police force headquarters, Wuse Divisional Headquarters and FCT Command.
Pleasure. Thank you very much.
Thank you.
Thank you.
The only request from these essential workers is for Nigerians to stay safe by staying at home, as efforts are being put in place to flatten the growing transmission curve of the virus. Adebola, Brooklyn Sunday, NTA News.
And for clarity, the lockdown actually commenced on the 30th of March. The Ministry of Humanitarian Affairs, Disaster Management and Social Development is working to expand the number of most vulnerable Nigerians captured in the social register. The Minister, Sadia Umar Farouk, was speaking at a meeting with leadership of the National Assembly on the distribution of COVID-19 palliatives. National Assembly correspondent Ignatius Nkwo reports.
The Minister of Humanitarian Affairs and Disaster Management, Sadia Umar Farouk, arrived Senate conference room to brief leadership of the two chambers on the ministry's mode of operation in the heat of the coronavirus lockdown. The legislators demanded to know the state of COVID-19 aid distribution to the most vulnerable Nigerians, how the ministry arrived at its list, and the geopolitical spread of the palliative.
The National Assembly feels that we need to work together with the executive arm of government to ensure that the most vulnerable people benefit from the Empower and so many other projects we have under the SIP.
So on our own part, the first thing we need to do and run with it is to codify what you're doing and put it in law.
The minister explained that the palliative in form of food is to be handled by the National Emergency Management Agency, while her ministry is handling the conditional cash transfer and other components of the social intervention program.
You may recall Mr. President also directed that we should give 2 months advance payment to these poor and vulnerable households. And that was what I also flagged up in Kwali.
The ministry is using the already existing social register in the distribution of the funds, as the minister also explained modalities for the continuation of the school feeding program now that schools are not on.
Rather than giving the cooked meal, since students will not be in school, so we're identifying the households where they come from to take this 1 month food ration to them.
The meeting was also to make the process of identification of vulnerable Nigerians more inclusive. From the National Assembly, Ignatius Nkwo, NTA News.
Meanwhile, the Nigerian Customs Service, in compliance with the presidential directive, has released assorted food items, vegetable and clothing materials to the federal government to boost efforts towards alleviating sufferings associated with the ongoing lockdown in some parts of the country. The estimated market value of the items is put at 3,251,806,000 naira. A statement by Joseph Atap, Public Relations Officer, notes that all edible items were certified fit for human consumption by NAFDAC before released to the public. It says the Nigerian Customs Service remains committed to strictly adhering to all extant laws governing seized and overtime cargoes. And the federal government has declared Friday, April 10 and Monday, April 13 as public holidays to mark the 2020 Easter celebration. A statement signed by the Permanent Secretary, Minister of Interior, Georgina Ihuria, says the Minister of Interior, Ogbeni Rauf Aregbesola, urged Christians to emulate the outstanding characteristics of Jesus Christ, amongst which are tolerance, love, peace and compassion, and most importantly, use the occasion of this year's Easter celebration to pray for Nigeria and the entire world at this time of global emergency of COVID-19 pandemic. While wishing Christians peaceful Easter celebration, he assured that the Buhari administration would continue to cushion the effects of the pandemic on the lives of Nigerians, especially with the palliative measures already put in place. Pelican Queens appeal for unpaid wages. And Amaza Marcus brings us details of this and more on Sports Updates.
The Cross River State Commissioner for Sports, Ofa Aya, has promised to look into the allegations of the state women's football team, Pelican Queens, of